Okay. All right, well, thank you guys all for joining me and everyone else from our FCI team today. I'm really excited to present to you some of the work that we've been doing the last few months specifically, but this work has been really been going on for the last few years. So I think it's a really important topic, a topic that doesn't get discussed nearly enough as it should, about women's health and cancer prevention strategies in female firefighters. So I'm going to talk to you a little bit about what we know about women in the fire service, and then go into some of our studies that we have done both at the state level and at the national level. So as I mentioned, today's agenda will go through overall work-related health and cancer risk in female firefighters, also talking about what is out there as far as cancer epidemiology on women firefighters, some of the qualitative work that we've done both in the state of Florida, but also nationally, and then talk about our cancer screening programs, both the past, present, and our future directions on what we're doing. So just to give you an idea about the population of women in the fire service. So right now we know that there are just over 1.1 million career and volunteer firefighters in the United States. Of that, 8% of them are women. And so we know that there's been a 3% increase since 2015. So we know that the population of women firefighters are increasing, and that 11% of volunteer firefighters are women. So 4% are career firefighters and 11% are volunteer firefighters. And so although we see an increase in numbers in this population, we still see that there is a lack of research being done specifically on the needs of female firefighters. So some of the work that has been done at a national level, and we see that some of the work-related health concerns of female firefighters really range. So one being the increased physical injuries and fatalities due to the job and the physical demands of being a firefighter. We also see complications related to pregnancy and fertility in female firefighters, and high rates of depression, anxiety, PTSD, and suicide are elevated within the population of women firefighters. So these are all things that we've seen in the literature. And then, what we're going to talk about today is the heightened risk of certain site-specific cancers that have really impacted our female firefighters. So from a national standpoint, as far as the epidemiological data, we know that in a national occupational cohort study of firefighters, researchers report that women had a higher incidence and mortality of breast cancer compared to the general U.S. population. So this was a study that was done by Dr. Daniels and colleagues in 2014. And then most recently in 2020, a study out of San Francisco reported that women firefighters who were exposed to higher levels of some carcinogenic compounds, specifically these were the PFAS and PFOA foams, compared to office workers or our general population, which would have a increased risk for breast cancer. Then taking a look at some of the work that has been done in Florida, we look at the cervical cancer incidence in Florida female firefighters. So what you can see here, this is the work that was done by Dr. David Lee about 15 years ago, and this is kind of the basis when we started the Firefighter Cancer Initiative 6 years ago of what cancers were really a high incidence in this population. And so what we saw in the Florida firefighters from 1981 to 1999 in females is that there was an increased incidence of overall cancer, Hodgkin's disease, thyroid, and cervical cancer. And so as far as the cervical cancer, it really stuck out to us. And you can see here, if we're looking at the SIR, it was at a 5.24. So what we know is anything over 1 is an increased risk. So, you'll see here, you have overall cancer 1.63, thyroid cancer 3.97 for female firefighters. But here, this really stuck out at 5.24 as far as the main concern of why is this population having such a high incidence of this type of cancer, and a cancer that we know that is very preventable with the with proper screening, such as the pap smear and HPV testing. So this is something we really wanted to look into. In addition, in the last year, Dr. Lee expanded on his work with the registry data, and so you can see here through this flow diagram exactly of what they did in this linkage. And so the linkage includes taking data from the State Fire Marshal's Office. So you can see here we expanded our range as far as the dates of firefighters. So instead of going to 1982, we were able to bring it all the way to 2012. Of that, we had over 109,000 firefighters that were identified as having a type of cancer diagnosis. 802 were duplicates, so you'll see at some point these were excluded. And then we linked that with the Florida Cancer Database System. So anyone in the state of Florida, if you are diagnosed with cancer, your name goes into this registry, into this database. And so you can see here from 1981 to 2014, there's over 3 million individuals who are diagnosed with cancer. And so what we do is we take the data from both of these registries and link them via Social Security number, name, date of birth, and address. And that was how we were able to come up with the final analysis data set of 3,928. And so of those 3,000, we had 168 female firefighters cases. And so what we look at next is, overall, the elevated sites that we've seen most recently. So again, we see thyroid cancer at 2.42, brain cancer at 2.54, melanoma at 1.68, and colorectal or rectal cancer at 2.02. So this new linkage data did not show cervical cancer, which is something that we're evaluating a little more. But just to show you what is the most recent data that's come out of the state of Florida as far as our epi data. So as I mentioned, when we started in 2015, we looked at that epi data and saw those high rates of cervical cancer. And it was very concerning because it was such a high number. And although the sample was pretty small of female firefighters, it was still something that, raised concern. And we wanted to know, what maybe some of the barriers were to screening, or, what could be identified as a cause of having such high rates in this sample. So you can see here we did multiple focus groups with female firefighters across South Florida. So we did with 20 women. Of the women, some of the emerging focus group themes that came out of this was the lack of routine screening. And the sub-themes within that we found was it was due to the shift work, that because, a firefighter works 24 on, 48 off, for most of the women who are trying to do a work and home life balance, which again, you'll see here as a sub-theme that came out, they said a lot of their health concerns were, put as a lower priority compared to their family. So, they said they would make sure that everyone else went to the doctor because, they would work 24 hours, they would be resting when they return, and then they're getting ready to go back to work, so making sure the household is ready to go before they leave. The other thing that was brought up regarding the screening was that many of them have their annual physicals that is done through their fire department, and so this would be your typical primary care physical. And so they said, I would complete that, and then I would just put it off about going to my annual women's check. Because I already completed what I need to complete for work, and then it's just something I would put off. The other thing is the firefighter culture, and this is something we hear about in many aspects, not just cancer screening, but just overall behaviors in the fire service. And so in this instance, they were saying that the firefighter culture was, about going to the doctors and having cancer screenings done. It was just, if I didn't feel that something was wrong, then I didn't go. So that's something that came out of our formative work with the female firefighters in Florida specifically. Then we did some more focus groups recently, but with a national study. So this included a total of 49 women. So we, almost doubled doubled our enrollment. And this included firefighters from California, Delaware, Florida, and New Jersey. And so similar questions were asked in regards to what their concerns were related to health and cancer risk, and what were some barriers. And so if you look on the left, with this formative work, again, these were focus groups. So we looked at the main themes that came out of it. So the main thing was the perceptions of work-related health and cancer risk among these women firefighters. And so what the two main sub-themes that came out of this was, one, their occupational cancer risk. And they alluded that it was due to their hazardous occupational exposures, sleep deprivation, and also stress. So not only stress of the job, the physical stress of, cortisol levels spiking high while they were, sleeping and then going straight to a fire, but also the stress of seeing, very, gruesome and, different experiences on different calls. Their other main concern was specifically to their women's health. So again, female-specific cancers were brought up, specifically cervical cancer and breast cancer. Also, pregnancy and breastfeeding was a main concern of female firefighters. As far as, how long to stay on duty and stay active while you're pregnant, how long is too long, how long is too short, how much are they exposing their unborn child to the carcinogens that they know that they're being exposed to on the job. And then also breastfeeding came up as a really big concern because they wanted to know, they came back to the job after taking their leave, but then being exposed to the different carcinogens during their work hours, how much was that exposing their baby because of the breast milk that was then being extracted. And so the final thing that came out of that was lack of resources related to women's health. And so a lot of questions that are just unanswered, really pertaining again to their health and pregnancy and breastfeeding, because there's no set guidelines as far as what, how long is too long, how long should you be taking out, how long can you be breastfeeding for. So these are all things that we've taken into account when we were creating our studies. And so now I'm going to go into, what we did based on that formative work. So our cancer screening program. So we've done a couple, and then we have one currently going on right now. So again, all of our work that we've done with the Firefighter Cancer Initiative is always what we call CBPR, community-based participatory research. And so meaning that the firefighters, or our population of interest, they're the ones who really drive the focus of our research. And so as we saw in the first focus group data, their main concern or their main, I don't want to say concern, but, their main reason for not, or what they thought why there's a high incidence of cervical cancer was for lack of screening. And so what we did in our first pilot study is we addressed that exactly. So if they believe that there was a lack of screening, we provided this worksite/home-based cervical cancer screening. And so you can see here in the picture, there's a home-based HPV kit. So because the biggest barrier that was identified, through our focus groups was that there was a lack of time and because of their shift work. So what we were able to do is we were able to give them this home-based test, either give it to them in person at the fire station or mail it to them, and they were able to send it back. So this was really a feasibility and acceptability pilot study of these women firefighters. This was strictly with South Florida female firefighters. We looked at active female firefighters ages 21 through 65 who had no PAP smear in the last 3 years. So that would be considered that they were unscreened or underscreened based on national guidelines, no history of a hysterectomy, and no history of cervical cancer. So all women that were eligible and interested received an HPV self-sampler kit, as I mentioned, either at home or the fire station, and then with directions. And then based on their results, we would, if it was a negative result, we would give them the results, and they would get those through the mail, so they have for the records. And then also, if it was positive, then we would refer them to see a OBGYN for a follow-up. And so what we learned here, we saw that nearly 60% of the firefighter participants reported not having a pap smear over 3 years due to the lack of time. So those are just the women who had not had a pap smear in the last 3 years. But what we did see is that of the women we screened for eligibility, 247, only 26 were eligible for this, meaning that either because of age, history of cervical cancer, hysterectomy, or that they were up to date with their screening. So, you know, what we learned is although women had identified lack of screening as a main reason, they really had been up to date with their screening. Most of the women had had a pap smear at least within 3 years. Many of them, I think, were very stuck on the old guidelines where you have to have a pap smear in the last year, once a year, but because of guidelines have shifted, many of them fell into the category as ineligible because they had had a pap smear in at least 3 years. But we did see a majority of our participants that about 81% reported not receiving the HPV vaccine. Also, that 73% of our participants identified a place of care for preventative care and annual physicals, and 15% of our participants had previously been diagnosed with cancer. So, as I mentioned, of the 26 kits that were sent out, 14 of them returned, and of the 14 that completed, we had 1 positive. And so what that led us to believe is, our general findings from this one, our feasibility study, that it was feasible, and it was acceptable based on the women's feedback as far as receiving a home-based test. We realized that their screening behaviors weren't as bad as they had initially thought. So a majority of them had actually been up to date with their screening. And so this led us to our next program where we wanted to look at not only the HPV rates, but also the microbiome of these female firefighters. So to see if their microbiome or pH levels had changed or are different than what the national general population is. And so what we did is we did something very similar to the pilot study where it was home-based. They would receive a kit either, again, in person with us there at the station, and they would give it back to us right then and there. They would just go to the restroom, do their self-sample, and give it to us, or they would take it home and then mail it to us. And so we collected actually 2 samples here where we collected the HPV, and then we collected a vaginal swab for the microbiome. So you can see here we had 35 swabs that we collected, and then I'm going to go through the data here of the microbiome, and we've grouped them in 3 groups. So you can see here 1A, 2A, 3A, and we did that based on years of experience. So 1 being 0 to 4 years experience, 2 being 5 to 15, and 3 being over 16 years. You can also see in this demographic chart, we had a mean age of 40.5, average tenure was about 12.4 years. And then you can see our demographics, about 80% were white, and 11% considered other. And then as far as rankings, it was pretty well distributed throughout as far as the rankings. We had chief, captain, lieutenant, driver, engineer, inspector, firefighter, and firefighter paramedic, which would probably go together, but that's just how they identified themselves as their rank. And so again, as far as the workflow, as I mentioned, it was the same thing that we would give the samples to the firefighters. They would give them back to us. They would do a self-sampling collection, and then we would then send it to the lab. So as far as the microbiome goes, they would do a DNA extraction, a shotgun sequence, and then the microbiome profile was created. And so what we can see here, I know this is a very busy slide, but I just wanted the main outcome of this, or takeaway from this, is that these are all different genera of the bacteria, and so you can see how many are represented. So we see that in our sample of female firefighters, it was a very diverse bacteria was detected. And so what I'll do here, because if we went through every single one of these, we wouldn't see too much because it's so diverse. But what we do see here, when we look at the most abundant species, these are the 10 highest that we saw. So we see the lactobacillus. And so what I'll show you here is anything that has the lactobacillus, that is considered your good bacteria. And then anything, the darker you go, is considered your bad bacteria of the microbiome. So when you see the Gardnerella, that's considered the not good bacteria. So when we see here, we saw that 45% of lactobacillus was the dominated microbiome of our sample of female firefighters, and 25% actually had the actinobacteria dominated microbiome, which is actually considered our bad bacteria. And so even though we see a 45% of our sample that had the good bacteria, we would expect that number to be much higher in the population. So based on US studies, white women should have about 80% of this lactobacillus dominated in our microbiome. And that's for white women and Asian women. And then for our African Americans and Hispanic women, we would expect it to be at about 60%. So regardless, and we saw in our demographic data that our sample is predominantly white. And so we can see that this is much lower than what is expected in our general population. The other thing that we see, as far as the 25% with the actinobacteria, and what that means when I say the bad bacteria, this is something that's very common that we see when people are either postmenopausal, but it leads to bacterial vaginosis, as well as difficulty in fertility. We also know that it is an increased risk of miscarriages, as well as a negative success rate when going through IVF. So, it's something that was very interesting and was, very concerning, especially since we've seen in the literature in the past that female firefighters, their main concern was related to pregnancy, fertility, miscarriages, and things related to childbearing. So then what we've done here is we've broken it down by the two main bacteria. So down here, the lactobacillus, as we mentioned, these are all the good bacteria. And then we see here the Gardnerella vaginalis. This is our bad bacteria. And so the lighter graphs here, these are our by years of tenure. So again, the light color is 0 to 4 years. Our medium green is about 5 to 15 years, and our dark color is our greater than 16 years of tenure on the job. So we can see here that with our bad bacteria, that it's much more prevalent in women who have, been working on the job for greater than 16 years. We really don't see many here in our 0 to 4 range. So age may be a confounder, which we are aware of, but we are seeing that there is a trend based on tenure. So the longer that you are a firefighter, it seems that your microbiome is shifting. And then we see here the lactobacillus, which we know is our good bacteria. This is what increases when people are taking probiotics and things of that for, better vaginal health. We see a much higher rate here in our younger group, or our lower tenure group of experience. It's about the same average in the middle, and then we see a lot lower rates here in our more experienced firefighters. I will also say that of the, in the questionnaire that we asked the women, we do ask if they were on any antibiotics, which we know would decrease this lactobacillus, or if they're on any probiotics, which would increase it. And none of them were on either of them. So there was no, change that could make a difference in these numbers. Okay. So again, this is just basically showing you the same thing, but showing you the different age groups, again, with the different types of bacteria. So again, we see a much higher rate here with our larger age group in our Gardnerella vaginalis, and then here the lactobacillus. We can see it's pretty even. There's not a huge difference between the three age groups. Then the other thing we looked at specifically was our ethnicity group. So we saw a pretty even grouping as far as those who are Hispanic compared to those who are non-Hispanic. So we saw 19 Hispanics compared to 16 non-Hispanics. And so we see here there was a much higher rate of the relative abundance of the bad bacteria, the Gardnerella, here on the left, which is our Hispanic group compared to our non-Hispanic group. And again, we didn't see much of a difference between the lactobacillus. So we see that although there was a higher of the diversity and a more abundance of the Gardnerella, there was about equal abundance of the lactobacillus. And then again, we looked at race. Race, we didn't really see a big difference, mostly because we really didn't have a very diverse group as far as what was identified. Most women identified as being white. So this is something as far as our future steps in our next study, we want to make sure that we have a more diverse population if we're able to control for that. And then this looks at the actual HPV. So as I mentioned, although we were collecting microbiome samples, we still were collecting samples for HPV. So of the women that were tested, the 35 women, we had 4 of them that tested positive for HPV. None of the 4 were type 16 or 18, which are the common ones that I'm sure most of you have heard of, and that's that the HPV vaccine works against. But they were other types of HPV types. And so with that, we can see that here, and we also see, in this graph, we look at basically those that were positive and how it aligned with their microbiome. So we see here the 2 positives, but it really didn't impact the other 2 who had Gardnerella vaginalis. So we didn't see a big difference with that. And then we saw 3 out of the 4 here that were positive, with about average rates of the abundance for the lactobacillus. And so lastly, just to show you a little bit about, again, these were the 4 women that had the positive HPV, and we look at and see the diversity of their microbiome, one being that they had fully the lactobacillus here, but then we can also see that some of them were very diverse, and they had some Gardnerella here and also here. So conclusions from this pilot project was that we do see a trend for shift in microbiome composition toward these opportunistic bacteria. And so again, these opportunistic bacteria, these are considered the bad bacteria that put women at risk for vaginal dysbiosis, but also increases, their chances of infertility, miscarriage, and, not successful rates during IVF treatment. We also saw that age and ethnicity may act as confounding factors, and that only 45% of the women had lactobacillus that dominated the microbiome, which, as I mentioned before, based on general data, it should be closer to about 80% for white women and about 60% for African American and Hispanic women. And so that brings us to our next, in our current study that is currently going on, that's been funded by NIOSH. And so what we're looking at with this study is taking, both pieces of what we've done and adding another layer to it. So you can see how we've grown each of these projects. We started with the focus groups of really trying to understand what their concerns were, what their perceptions were, then going to see if it's feasible to give firefighters a home-based test, and then adding the piece on the microbiome. So now this next study that, as I mentioned, we're currently enrolling participants for, and doing this at a national level. As I mentioned, the other ones we really stuck to just South Florida and Florida. But this would be examining the cancer screening behaviors, again, through a home-based HPV test, and then measuring the microbiome as we've done in the last pilot study, but now also taking samples of known carcinogenic exposures in the vaginal area. So we'll be testing for PAHs, polyaromatic hydrocarbons. So these are common compounds that we know are carcinogenic, that off-gas after a fire, that we've seen in the fire station, in the bays. And so we want to see if that is something that may be a contributing factor of why we're seeing this shift in microbiome in the female firefighters, as well as why we're seeing, a higher abundance of these opportunistic pathogens. So we are enrolling, our target is 200. We would include, and this is actually based on, two groupings, half being that the women are considered under-screened or not screened, so they haven't had a Pap smear in the last 3 years. And then also really any active female firefighter, regardless of their screening history, to see if there's a difference between the two. We really want to work at increasing enrollment, as I said, at a national level, but really focusing on women of a diverse group, and looking at volunteer firefighters and looking at women who are in rural areas that maybe not have as much access to care as we've seen in South Florida with our larger departments. And so the other thing that we really focused on in the last year is our education materials. So as I mentioned in the focus groups that we saw at the national level, a lot of the women stated that there was a lot of just lack of resources when it comes to female firefighters and specifically, their health risks. And so we talk here, and, it's not made specifically just for women. This one is obviously the cervical cancer, but for HPV, we talk about what types of cancer can be caused by the HPV, the human papilloma virus, and that it's not just cervical cancer, that it could be oropharyngeal, anal, penile, vulvar, and vaginal cancers. And so it's really important that people understand what the risks are of HPV and why it's important to have the vaccine, both men and women. Men right now, middle-aged men, we're seeing a really high incidence and increased incidence of oropharyngeal cancer because of HPV. And so, educating them on how, it used to be the recommended age range for vaccination was 11 to 26. It is now recommended that individuals ages 27 to 45 can consult with their doctor about getting the HPV vaccine. So this is something we really want to stress in the fire department because we don't think that it's been shared enough. The other thing, here we've created these forms, these flyers for our firefighter partners to share, specifically related to cervical cancer for our female firefighters. And so this will be implemented again in our new study. And then going into our future directions. So as I mentioned, this new study that we're currently working on and enrolling, we're looking at not only the HPV and the microbiome, but also looking at how these workplace exposures can play a role on the female firefighters' microbiome and HPV status. We want to expand our screening program to a national sample, a more diverse population, and to our volunteer firefighters. The other thing that we're doing, and as you can see by your attendance today, is increasing the reach of women through virtual seminars and online education events. So we've had to make some significant changes as far as how we plan to recruit and enroll women for these studies. Before we would be going to different conferences. We would have tables set up, we would go and do station visits and educate the women on the different studies we're doing. But now, in light of COVID and because of different travel restrictions and research restrictions, we will be doing most of our recruitment strategies via online Zoom calls, seminars, videos, and then everything will be through the mail. And that is where I stop there. So if anyone has any questions related to any of the programs or current or future programs, I'd love to take any of those questions. Nope. All right, so I don't think we have any questions. Again, I appreciate all of you guys coming. If you think of anything and you want to send an email, or if you think there's interest in your fire department or any of the partners that you have that would be interested in the new study where we are enrolling women not only from Florida but from all over, please reach out. If not, we probably will be reaching out to you as well to get people enrolled in the study.
Great. Well, thank you everyone for joining us. And like I said, our seminar series is going to continue next month, and it's the fourth Thursday of the month at noon. So thank you all for joining. We really appreciate it. If you have any questions later on, please feel free to send us an email at firefightersstudy@miami.edu or Dr. Solle directly.
All right. Thanks, everyone.
Thanks.
Thank you.